Now, Brazil has overtaken the United Kingdom, becoming the country with the third highest number of coronavirus cases in the world. The Health Ministry is expanding use of the drug hydroxychloroquine as a treatment. The move is being backed by President Jair Bolsonaro, despite doubts over its safety and effectiveness. Brazil recorded its highest daily death toll on Tuesday, with more than 1,100 fatalities.
Estamos perdendo essa batalha contra o vírus.
We're losing the battle against the virus, that's the reality. The virus at this moment is winning the war. These days coming up, the holidays, I don't see them as holidays, but I see them as battle days, the most important days in the fight against the virus.
Gustavo Ribeiro is the founder of the Brazilian Report, an online magazine. Joins me now via Skype from Sao Paulo. Good to have you with us live on Al Jazeera, sir. Just as an overview, can you tell us what the situation is like in one of Brazil's largest cities?
Thanks for having me. Well, things are spiraling out of control. We're still having high numbers of new infections and new deaths every day. São Paulo is by far the leader in Brazil in terms of infections and deaths, but that's also related to the fact that the metropolitan region of São Paulo concentrates 10% of the Brazilian population. So that was to be expected. In terms of confirmed cases and deaths per million people, Amazonian states and states in the Northeast, which are the two poorest regions in Brazil, which are less equipped with healthcare facilities, those are the areas where the outbreak is worse. But the problem with São Paulo is that social isolation rates are very low. Consistently below 50% of people are staying home, and experts warn that that could lead us to a situation where we don't have a peak in São Paulo, but rather a plateau with a continuous high number of new cases and new deaths for a long period of time.
You just mentioned there 50% of people aren't staying at home. What's the reason for that? Is it because they don't believe there is a danger out there, or that there is a necessity for them to leave their abode where they live because they have to go out to either go shopping or go to work?
Both cases are happening because part of the population that supports Jair Bolsonaro is belittling the intensity of and the severity of this outbreak. But yeah, like you said, a lot of people must go out and earn their money every single day because Brazil has a very informal economy, and a lot of people depend only on themselves to make ends meet. And that's where the government should step in and offer ways for people to stay home, even and provide them with some relief money. But actions have been have not been enough, and the few actions that the government has carried out have had a lot of glitches in terms of emergency payments that were delayed. So people just feel the need to go out and earn their money every day.
Since this pandemic began, and we've been reporting globally about the fact that even rich countries are having a real problem in coping with the volume of people who are infected or need hospital treatment. What is that situation like, across Brazil? Are hospitals able to cope? Are there enough beds?
In many states, the healthcare network has already collapsed or is very close to collapsing. In São Paulo's metropolitan region, we are around 90% of beds are occupied. We have two very distinct situations when we look at the public healthcare network and the private one. Private facilities have much more intensive care beds per million people than the public system. So in a lot of regions in Brazil, states and municipalities are renting those, are paying private hospitals for the right to use their facilities as well to cope with the demand right now.
We're again seeing different types of pictures, Gustavo, of the way the president is getting his message across in terms of belittling what COVID-19 is all about, and certainly banging the drum in support of hydroxychloroquine. Over the last 24 hours, what's your general sense about that response, either in the media or in the public domain? What are people saying to you about what they believe is happening in their country and what they think is accurate and what is inaccurate when it comes to medical advice?
Well, the problem is that people don't necessarily know who they can trust, because the president says one thing, the health ministry said another thing. So the president has created an environment in Brazil where people just don't know what is true and what is false. We have seen a study that was published today that shows, for instance, that YouTube channels with misinformation on COVID-19 are watched over 3 times more than reliable sources. So that's another reason for the fact that compliance with social isolation is so low in the country, because we're just not getting information from reliable sources. And unfortunately, in our case, the federal government or the president himself has not been a reliable source, because like you mentioned earlier, there is absolutely no evidence that chloroquine is effective. Some studies in Brazil and in the US suggest that death rates are actually higher among some patients that take chloroquine. So the jury's still out on the drug, and the president is selling it like it's a possible cure for COVID-19.
It's very good to get your insight and your thoughts. Gustavo Ribeiro there from the Brazilian Report. Thanks so much for joining us from Sao Paulo.
Thank you.